Hello and welcome to another episode of EHA Unplugged. Not too long ago, we had the pleasure of speaking to Professor Ana Sureda from Spain. Professor Sureda has a lot of experience and knowledge in CAR T-cell therapy, so we took the opportunity to ask her a couple of questions. In this episode, you'll hear Professor Sureda talk about the challenges in receiving CAR T-cell treatment from a physician's point of view. So listen on and enjoy the podcast.
My name is Ana Sureda. I am the head of the Clinical Hematology Department at the Catalan Institute of Oncology in Barcelona, Spain. I'm also the president of the BMT and one of the co-chairs of this 5th edition of the EU CAR T-cell meeting here in Rotterdam. So I think that CAR T-cell therapy has raised a lot of expectations for everybody. So of course for physicians, but of course for patients and patients' family, because talking about lymphomas, CAR T were initially introduced in patients that had really very poor outcome. So giving the possibility to the patient to be treated with one shot therapy, which is one of the benefits and the beauties of CAR T, was really encouraging, and it was really very positive for them. After having said that, of course, CAR Ts are effective, but they have their own personality regarding side effects. So we have learned about some side effects that we were not used to manage. From a physician's point of view, we have had to learn on how to manage these side effects, and we have had to put together a multidisciplinary team to be able to cope with these side effects. And of course, these side effects need to be told and informed to the patient. So the patients need to be informed that CAR T cells can be eventually a curative therapy, but they're associated basically with CRS and neurological toxicity, not in 100% of the patients, but in a significant proportion of them, that the patients can experience cytopenias, which might be more or less prolonged over time, and then there is, of course, more immunosuppression on them, and we have to take into consideration, and they have to understand that there might be infectious problems associated. So I think that patients need to be clearly informed as much as possible, and they need to clearly understand that the benefits, but also the toxicity profile of CAR Ts. Another important aspect is that, unfortunately, CAR T accessibility is still a problem. And this is something which is quite peculiar to CAR T, than with other drugs that we have been using for many years. And not every single center, for instance, that it's performing transplantation is performing CAR T, or it's being accredited to be a CAR T cell treating centers. So patients also need to acknowledge that, and let's say if they are being treated in centers that are not CAR T cell treating centers, they will have to be transferred their care to CAR T cell treating center with all the hurdles and the obstacles and the difficulties that this represents. So if the center is not very far away, that's absolutely fine, but even with that, the patient will have to be treated by another group of physicians, and this is something that patients don't like too much, because they are usually happy and used to treat with the same physicians for a long period of time. In the more difficult cases, patients will have to travel and to go to another city, to another village, with what this represents from a social point of view, from a psychological point of view, to have to leave their city, their house, and then to have to live for several weeks somewhere else. It's important for the health, for the caregivers, and it's really very important in a CAR T cell program that you identify these patients that have a caregiver, and there is a big commitment not only from the patient's point of view, but from the family support and the caregiver, because they represent a really very important aspect in all this journey. So they also need to understand that. And the other thing that they need, that patients, and I think that all the scientific community need to understand, is that unfortunately, if we talk about Europe, we have difficulties in access, but in other parts of the world, there is no access at all. And this is one thing that needs to be discussed and needs to be worked in a multidisciplinary fashion. And I think that strong patients associations and patients advocates play a major role here, because at the end, they are going to be the ones receiving the treatment and finally benefiting from the treatment. So we really need to have very well informed patients associations, groups of patients, because their voice is really very important to improve all these obstacles that are associated to CAR T-cell therapy.